get to the questions. So the first one is a nurse is caring for 4 clients. Which one need clarification of medication order? So basically, this is a short answer question. So, but the way to answer questions, you go through the acts, the case, the buzzwords, then you rewrite it, and then you use your content, you go and answer the question. So basically answering questions backward. You start from the back, and this is a prioritization question, therefore, but in the form of a SATA. So you can get both. You can get a SATA question in the form of prioritization. And I think the next generation questions are like that, where you have a bunch of answer choices and you go and select. So you should practice this one. So basically, what do we have? We have which one they need clarification, okay? There's 4 clients. So you want to figure out which one doesn't match appropriately. It's a side effect, or it doesn't need to be given right away, or there's something going on. So you use that information and go and look at what they have for you. So you have a client who have CHF, it's on digoxin, and he has an order for nifedipine. You know, digoxin, one of the side things you need to avoid is calcium channel blocker. So this is a calcium channel blocker. So you should avoid this in digoxin patients. So definitely this is negative. You should also avoid ephedrine. You should avoid low potassium, high calcium, and low magnesium. And you should also avoid local rice, okay? This also causes hypokalemia. So this one, I need clarification. The client with paralytic ileus and order for dicyclomine, then you ask yourself, bring your pharmacology. There's 2 buzzwords. Paralytic ileus, that means fancy word for, it's no obstruction, but the bowel has slowed down. And dicyclomine, you ask yourself, what is it? This is an anticholinergic. What does anticholinergic does? It slows down the bowel. So we make the patient constipation. Patient is already constipated. It's not constipated, but the bowel has slowed down. If you give them dicyclomine, it's going to make it worse. Therefore, you need to clarify. So one of the contraindications for dicyclomine is like already paralytic ileus, or you have obstruction, because it's an anticholinergic. It's going to worsen that. You know, other side effect too. So you can pee, it's going to worsen your glaucoma, and your mouth is going to get dry. Those are all side effects of anticholinergic. Those 4 things should come out whenever you see an anticholinergic medication. A client with cirrhosis and an order for acetaminophen. Of course, you shouldn't do that. Cirrhosis, you don't want to avoid any additional liver injury. And acetaminophen will cause additional liver injuries. Therefore, we got to clarify. A client on tube feeding and order for carbidopa, levodopa. This is a tricky one. I intentionally put it there. When you're on this medication, you should avoid high protein, okay? Avoid high protein diet. Therefore, if the patient is on tube feed, it doesn't mean there is a contraindication. It's a information I want to pass on to you guys in case you see a question. It doesn't mean there is contraindication that you can't get carbidopa, levodopa. Otherwise, most people on this medication cannot get it. Some of them have other medical problems. And so you just need to hold the tube feed for 2 hours, give it to the patient, and after that, then you can restart it again. So you shouldn't give it simultaneously with tube feed, so you should avoid it. So we don't need clarification. The nurse should know that you shouldn't give this together with tube feed, but you have to hold it. So the nurse just have to hold it, and she knows that she doesn't need any big clarification. A client with asthma and order for Motrin. Motrin is one of the medications asthma patients should avoid because it causes nasal polyps, and it worsens, and it causes more exacerbation. Therefore, they should stop it. They should avoid Motrin so they can take Tylenol. So these four, I need to clarify. So that's how you answer prioritization question. Some content level, like I said. Content is all the things you need to know. If you master it, I mean, there's no way. They can set the questions whatever they want. So far as you know the details of it, yes, you'll be able to like see that this is straightforward. It will be screaming at you. The answer choice will be screaming at you like, hey, pick me. This is right. This is not wrong. Okay. So that's that one. We take care of it. And number two, we have a nurse is caring for 4 clients. Which one need clarification of medication order? Okay. And this is the same thing. Like I said, I always try to give you 2 things at the same time. It's a basically pharmacology and a prioritization question. At the same time, you prioritize and then you SATA it. Okay, that's the way it goes. So the same thing. Which one need clarification of medication order? Select or apply. And this is caring for 4 clients. So we want to see who have a problem. A client with sore throat and order for clozapine. Something should be ringing in your ear. Clozapine is a medication, they really love it. It's an antipsychotic. It has other side effects, anticholinergic, other extrapyramidal side effects, but the most important thing is agranulocytosis, and this is what they like. They like this. Because of that, anybody on this medication, even with the small fever like 101, 99.5, or a runny nose, that's a priority patient. You got to go see them. You have to be sharp. So this is a sepsis on B sharp. So anybody who is on clozapine, small fever, runny nose, sore throat is a priority patient. You have to see them. So sepsis. So this patient need to be clarified. A client with, he has other side effects like QT prolongation and other things. You can check my pharmacology lecture on the 7 days challenge. He has detailed pharmacology. If you really want to pass the pharmacology, you should listen to that video, which has a lot of pharmacology questions medication that will usually come in your exams. I pick a couple of them. A client with SIDH and an order for desmopressin. What is SIDH? It's basically patient who excessive production of ADH. ADH will cause reabsorption of water and then water retention and fluid overloaded. In order to prevent this, you need to block SIDH. Desmopressin is the same thing as SIDH. So you worsen the problem. I intentionally put it there because there's a medication that block ADH. And this is demicycline. It's spelled almost the same. This is demicycline. It's not desmopressin. So you give them demicycline, that will block ADH, and that will take care of it. And therefore, we need clarification. A client with esophageal varices bleed and order for propranolol. When somebody is bleeding from esophageal varices, you always have to bring your content. Usually, so if you're bleeding, we want to decrease blood flow to where it goes, where the bleeding is occurring, especially in where the esophagus and a splanchnic blood flow. So you use a vasoconstrictor. This is a form of vasoconstrictor that decreases blood flow to the GI tract. So propranolol is one of the medication we use. Content level, you use propranolol. So this patient need propranolol. You need a PPI. You need octreotide. You need some blood. And then you need basically to be monitored in the ICU. So I give you everything you need to know. A client with Kawasaki disease and an order for MMR vaccine after immunoglobulin. So this one, you don't need anything. So if you have Kawasaki disease, we usually give them aspirin and immunoglobulin. Why do you do that? To prevent aneurysm, coronary aneurysm. because of the immunoglobulin, there's no live vaccine. They cannot get live vaccine for 6 months. So kid cannot get live vaccine for 6 months. MMR is a live vaccine, so this is negative. We got to ask for it. A client with new onset AFib, heart rate 110, and order for Coumadin. This is always a trick question. And today, if you don't know it, you got to know. Today, just listen carefully. If you don't know it, this is very important. They can trick you. It's a question you should never let them take away the point from you. Anybody with AFib, the most important, number one, most important thing about AFib, when they get the AFib, is rate control. Nothing less, nothing more. Control their rate, bring them back to normal sinus, or you can still keep them in AFib, but the rate may be lower, like maybe 70, 80, and then you get an echo, and later on you can give them Coumadin. Coumadin is not number one choice for AFib. Number one choice for patient with AFib is rate control. You can choose any medication you want, but don't ever do that. Pick an answer of Coumadin. I know it's very attractive, but don't let it go. Rate control is the best way. So this patient, clarification. So 4 patients, we got to clarify. You see, our Sata question is easy, but at the same time, it's prioritization. So we're prioritizing this in addition to that. So pure prioritization, and you have to be sharp. So which statement need immediate intervention? So we need to intervene. There's form of intervention that we got to do. So intervention here. So I circle in my bars with. And NCLEX is caring for a client on amiodarone for several years. Which of the following need immediate intervention? So somebody is taking amiodarone and there's something we have to intervene. If I hear this, I go to my acronym that I use for amiodarone. I have some fancy one, and I call it P-clone, okay? And the way I did it is like, if you're on amiodarone, you get yourself cloned. That means you'll be dead if you have pulmonary symptoms. So P is pulmonary fibrosis. This is number one symptoms. Then 2 is cardiac. So this is cardiac. We have like QT prolongation. Then R is a liver. They can get a liver issue. So hepatitis. Then this is urine orthotoxicity. And N is a peripheral neuropathy. And E is the basically eye problem, okay? Optic neuritis, basically. And D is the skin, so dermatitis. The number one symptoms is pulmonary fibrosis. So when you hear amiodarone, think about P-clone. If you're on amiodarone and you get pulmonary fibrosis, you're going to get yourself cloned. That's how I remember it. You're going to get yourself cloned, and then you're not going to be happy about it. So if patient have pulmonary symptoms, any pulmonary symptoms is your number one. So blue-gray skin discoloration, no, it's part of it. It's not, you got to be sharp. Sharp. Elevated AST, that is liver problem. I'm okay. Peripheral neuropathy, yeah, it's here, but it's not important. Resistant cough, you see, persistent cough for a long time. This is fibrosis. They need what we call PFT, pulmonary function test. So sometimes they may ask you this. It just occurred to me. I need to let you guys know. This is very important. Anybody in amiodarone, they need pulmonary PFT, so pulmonary function test. Then they need liver function test. So the liver function test. Then they can also get a TSH, so thyroid function test. So I did not put it there. Endocrine, the I, you can also put endocrine. Yeah, I nearly forget. So I is endocrine too. So you put endocrine here. So they get TSH, liver function test, and PFT, in case you see. So we see this is a priority. You got to be sharp. This is a breathing problem, and so that patient need a prioritization. So let's see, we have one more. And the last one. It's a SATA in a prioritization, right? So a nurse is caring for, so what is our ask? Which of the following need immediate intervention? Something we have to intervene. A nurse is caring for a client with asthma who will be discharged home with theophylline. So it's going on with theophylline, okay? Which one need intervention? Before you answer your question, come up with your content. See if you can remember something and use it, and that will prevent you from guessing. Don't compare answers. So we know our acts, we know our case, we know our buzzwords. You're on theophylline, what are the things I need to intervene? And then you go with your content. The theophylline, the way I remember is I usually put T's, 3 C's and 2A. I know it's not that fun. The C, the first C is cementidine. So they should avoid cementidine. The second C is no caffeine. The third C is Cipro, antibiotic ciprofloxacin. They should avoid it. And the A is alcohol. And the other A is acetaminophen. So the last, this is, you can put another C. You can say 4 C's with the 3 C's specific for cementidine, coffee, and ciprofloxacin. And the last C is anything that affect the liver. That's the way you can say alcohol affect the liver. And what did they call it? The acetaminophen also affect the liver. So you already answered the question before even you look at the answer choices. So avid coffee drinker, negative. We got to do something about it. On cementidine for reflux, yeah, the doctor need to change the medication. Patient has 2 strike. Ciprofloxacin for recent UTI, yeah, 3 strike. Drink 2 to 3 beers a day, yeah, 4 strike. And then Motrin for pain. Well, this is fine. It's not, Motrin is better than acetaminophen. So 4 out of 5 strikes. So we're going to check the medication. I don't think this patient should go on with theophylline. And this is how you answer questions. It's fun, guys. So thank you for listening. I hope you're learning something and ready to go ace this test. Keep charging as always, and all the best of luck. Bye.